Cochlear implants are designed for patients who are no longer able to benefit from a traditional hearing aid or who have a hearing loss that's not amenable to other surgical repair. So those individuals typically have a severe to profound hearing loss and go through a routine of test batteries in order to determine if they qualify. Nowadays, individuals who are born without hearing typically undergo such a process to determine their candidacy for a cochlear implant. And many of those individuals go on to receive implants in both ears if they have hearing loss on both sides. We also will now implant individuals that have hearing loss in just one ear in order to give them access to sound via both ears and be able to localize sound and hear somewhat better in background noise. Indications for cochlear implants have expanded too, and even individuals that have some low-frequency hearing can now benefit from cochlear implants that selectively provide sound information at mid and high frequencies. So our indications over time have shifted quite a bit and allows a multitude of individuals, both pediatric and adult patients, to be able to benefit from the technology. Children who are born without any hearing whatsoever would be eligible for a cochlear implant early on in life, typically close to 1 year of age. For individuals that are born with some hearing, we monitor that hearing over time, and if we find that they no longer benefit from a hearing aid, they could become a candidate for a cochlear implant. So in pediatric populations, cochlear implants can be done anywhere from early on at 9 to 12 months of age up through young childhood and adolescence.